Dr.Tseilhoutuo, Honorable MLA of Kohima Town. Guest of honor, Sri V Kezo, Commissioner and Secretary, Health and Family Welfare, Government of Nagaland. Organizing Chairperson of 19th AONEI Con, Dr. V Kezo. Organizing Co-Chairperson, Dr. Newte. Honorary Secretary of AONEI, Dr. Tseilhoutuo. Organizing Secretary, Dr. Kohima. The Director of B. Budwa Cancer Institute, Dr. B. Thakur. Padma Shri and Ramon Magsaysay Awardee 2023 recipient and past President of AONEI, Dr.Ravi Kannan. 19th AONEI Orator Professor, Dr. C.S. Promesh, Director of TMH Mumbai. Professor Dr. T. Subramanian Rao, Dr. Shukla, Dr. Saurabh, Dr. Harsh, today's the live surgical works of faculty. Dr. Pankaj Chaturvedi, Deputy Director of TMH Mumbai. Dr. B.C. Goswami, the former Director of State Cancer Institute, Guwahati. Our past President, Dr. T. Tomsa Singh, Dr. Kudus Ahmed, the invited guest speakers, faculties, delegates, EC members of AONEI, members of organizing committee, distinguished guests, and ladies and gentlemen. A very good evening to all of you. I, on behalf of AONEI, would like to welcome you all to this 19th Annual Conference of Association of Oncologists of Northeast India. It's truly an honor and a privilege to stand before you today as we inaugurate this annual conference of AONEI, a gathering that symbolizes our collective commitment to advancing the fight against cancer. As we come together from various corners of our country, united by a common purpose, I am filled with profound sense of hope and determination. Coming together is a beginning, staying together is a progress, and working together is success. I congratulate our founder members who got together and formed this association 20 years back. As an organization, we have done a lot, but many more need to be done to fulfill the aims and objectives of our society. As our Secretary, Dr. Tseilhoutuo, in his annual report mentioned that we have organized few CMEs, awareness camp, and no tobacco run, which was a grand success. On the same day, we have organized a CME on tobacco-related cancer. We have organized a press meet, and to create awareness among our public, we have organized a live TV program also, and few surgical workshops. So coming here, apart from regular activities, we are planning to include AONEI traveling fellowship for our upcoming junior doctors, and a series of postgraduate case presentation and master classes. I expect the participation from all, active participation from our active members. Northeast has high level of tobacco exposure than national average, and along with indigenous food habits probably leads to high volume of cancer incidence in this part of country, especially head and neck squamous cell carcinoma. We are planning to take some research project pertaining to the common malignancy in Northeast. So requesting our members to write some project which can be executed in collaboration with other institutions and which might change the future treatment guidelines. As AONEI, we can talk to other funding organizations who can help us to carry out research work in collaboration, because today's research is tomorrow's treatment. And I urge our AONEI members and other dignitaries on the dais and off the dais to come forward and together to make a difference in our society. As an individual expert in field of oncology, we can reach areas that we have not been explored before and spread the knowledge of oncology, especially in prevention and early detection. and make sure that every individual gets standard treatment, including palliative care, irrespective of financial status. Cancer in its many forms continues to pose one of the greatest challenges to humanity. It touches the lives of millions, transcending borders and affecting individuals, families, and community worldwide. But in this room, we find a community that refuses to be daunted by the enormity of these challenges. Let us strive for a world where every patient receives personalized and targeted therapies, where early detection is routine, and where the word cure becomes an everyday reality. In closing, I extend my deepest gratitude to the organizers, sponsors, and participants who have made this conference possible. Your commitment to the oncology community is commendable, and I am confident that our time together will yield invaluable insights and collaboration that will propel us towards our shared goal of cancer-free world. Lastly, I would like to end up with a quote of Ratan Tata. If you want to walk fast, walk alone. But if you want to walk far, walk together. Long live AONEI. Thank you.
I offer my sincere apology for not being there. I did start for Kohima this morning. Thanks to flight delays, I take this opportunity also to the organizing team for the honor of delivering the 2024. Over the next few minutes, to share my thoughts on reducing disparities in cancer. And towards this, I want to point out this huge map of patients that we saw at the Tata Memorial Hospital over a 6-month period. These are 75,000 patients who visited us at Tata Memorial. And as you can see, the vast density of patients that you see in and around the city of Mumbai is understandable because we are located in the city of Mumbai and you would expect that. But what was very disturbing was the fact that there was a large number of patients coming in from thousands of kilometers from northern, eastern, and northeastern India. And I don't need to tell this group the problems about traveling from a place like Naharlagun or Dimapur or Kohima or Silchar to a city like Mumbai or Delhi or Chennai just to access basic high-quality cancer care. It's not just the traveling that is involved, but also the cost and expense of living in a city like Mumbai for the duration of the treatment, with the result that several patients were unable to complete their treatment. And I think as a health system, we have failed these patients in offering them complete care. Right from our childhood, right from our schooling, we have been taught to value equality and value social equality in every aspect, whether it be age, race, culture, education, religion, or gender. And it is inherent in the most democracies and in the constitutions that you have, whichever you might look at, whether it's the United States, France, or in India, where it is up front and center in the preamble for the Constitution of India. However, when we look at the world around us, we are faced with extremes of inequality, whether it be related to economy, whether it be related to social status, culture, gender, race. We are faced with a lot of inequalities in the world. And I just want to use one example, something that is very easy to understand to illustrate how immense these inequalities are. There is something called the World Inequality Report, which looks at global income and wealth. And in the last report, what we noticed very clearly was that the top 10% of the world's wealthy own or earn more than 50% of the world's monthly income.
At the very outset, I give all thanks and glory to God for giving us a beautiful evening. On behalf of the government, under the able leadership of our Chief Minister Srini Pirio, and on behalf of all the Nagaos here, I extend my warm welcome to all the delegates to this 19th annual AONEI conference. Well, it's a tremendous privilege to be in the midst of so many talented, learned, and researchers regarding oncology, regarding cancer, and working hard all the best part of your life to give relief to the patient and their relatives who are suffering from cancer. As rightly stated in your theme, expanding horizons, what's known and what's new. Well, I'm sure there are so many young surgeons, young oncopathologists, oncophysicians, technicians, postgraduate students who are here. Take this privilege. In these 2 days, we're going to share, we're going to listen to experts who are going to share with us their experience and also the advices of gold standard treatment for this very disease. So it's going to be priceless these 2 days to come. And our presence here today is a testament to our commitment towards better treatment, better facilities, and accessibility to cancer treatment. So, everyone present here, I'm sure with this conference, we'll go back with broader knowledge, better things to share with the juniors, and giving relief, cure, and so on to your patients. Well, this very conference, I find it a bit different from the conferences I've attended. There are varieties of people here. As I said in the beginning, some are surgeons, some are physicians, some are oncologists, some are technicians, some are students. It is the collective effort that is required in the treatment of cancer. And choosing Nagaland, choosing Kohima to have your conference, it makes lots of meaning because Nagaland is graded, considered as the 11th highest incidence of cancer in our country. Is ranked 11th. And also, the second in the world when it comes to nasopharyngeal carcinoma. So today, I'm here as a special guest, but if time permits, the next 2 days, I will try to learn, I'll try to gain knowledge from the sessions that are in the program. I have done some surgeries which Many thought that it is not possible in Netherlands. I did a good number of VET esophagectomies. And in my experience, this is a message to the junior surgeons. Post-surgical fistula and injury to the thoracic duct slowly gives a death certificate to the patient. That is what I've experienced. So, in Nagaland, when it comes to treatment of cancer, I'm happy to see there are so many youngsters like Madam Kedovino, as mentioned earlier, Dr. Kuto, Dr. Sanan, and our onco physician like Dr. Ito, oncopathologists, we have Dr. Jovi, Dr. Yupo, and many more. I'm happy to see so many youngsters are already in the state. Yet, when it comes to treatment, the facilities are still far behind compared to the other states in the Northeast itself. But I'm sure, as I said, it's a combined effort. So those who are having all the facilities will guide us, will help us in procuring or installing the facilities required for standard treatment in our state. And for that, we need your help, we need your guidance. Cancer is such a disease. As I say, right from the opening of a syringe by a technician, by a pathologist, the process of diagnosis and treatment starts. So it involves everyone. Unlike the other diseases, where most of the time only the surgeon is glorified. But cancer is such a disease where everyone can be glorified when we give a proper treatment. So, another request to the seniors and the HODs of different institutes. Whenever you write a paper in journals, maybe national, maybe international, it'll be good if you can include, apart from your surgical team, if you can include the names of the onco-physician, onco-pathologist. Because many a times we see articles, only the names of the surgeons. We forget the radiologist, we forget the pathologist. It's just as a medical person, I'm just giving a suggestion that everyone should be counted. Unlike the saying, till the lions learn how to read and write, only the hunter is glorified. Unlike that, let us include everyone when we have to glorify some cases, or instead of glorifying ourselves. So cancer is such a problem, not only to the patient, not only to the patient party, but even the medical personnel, which involves all the sectors. So it's just a suggestion when you read such paper, please include everyone. Well, I have nothing much to share, but welcome to Kohima. Hope your stay will be comfortable. And our conference in the next 2 days, the knowledge shared, will bring us closer to a future where cancer is handled just like a common flu or just like a common fever. Wish you all the best for the next 2 days and wish you a happy stay in my city.
The organizers, all the delegates present, and our guest from Tata Memorial Institute at Mumbai. We have met some time ago. He has come along with interesting ideas. And to our senior consultant from BCI Guwahati. It's encouraging to see a lot of esteemed experts in this domain come to assemble here. I am confident that this will definitely bring much needed benefits to the community who are involved in treating patients affected by cancer. I must admit that a lot of things are yet to be done here in Nagaland. And only in a few places in the Northeast we have been able to leverage the full benefits of technology, of science and knowledge that is emerging in this field. I am no expert, but we are now confident that the Northeast is gradually and steadily acquiring capacities to handle this. And I am a layman. My concern essentially as a person who looks after the Department of Health and Family Welfare is to request that members of this community leverage the full benefits of the knowledge and technology that is emerging in this sector across the globe to adopt a more holistic approach and go beyond treatment into trying and understanding the reasons why these things happen. I am sure that unlike some diseases like polio, TB, I do not think that we can eradicate cancer. But we can definitely work together to mitigate the devastating impact that cancer has on lives, on communities, on families. And perhaps we can also adopt proactive measures so that steps can be taken for a more broader coverage of the population, to screen them, to take steps that will, reduce the effect that it can have if left unattended. And a lot of people actually come to find out about it only at the final stages. And I'm also very interested and happy to see that the Indian Council of Medical Research is presently undertaking a study about the diet and food habits of people of Nagaland. I think there lies the real secret behind why we are having so many cases per average population in this country. And I think a lot of it has to do with lack of awareness. They are not really complicated steps to be taken. It's more of an awareness that needs to be generated. And it's, I think, very important for us to now begin to speak out how lifestyles need to be modified, and how to persuade leaders of communities to participate in a more proactive way so that they can assist your community in multiplying its reach. For sure, it is not possible for you people to reach out to every single member of the population. But there are so many ways in which we can reach out, create awareness, and generate willingness to change things that need to be changed. So I extend my sincere appreciation to the members of AONEI. And I'm reminded of the move of the government of India to eradicate leprosy by 2025, which is right round the corner. And a lot of programs and schemes and interventions have given us so many points of reference, things that experiences, knowledge, practices that we can also adopt similarly to tackle this menace, this devastating disease. And like I said, I am no expert, but I believe that it's not something that can be eradicated, but we can surely make things much easier and manageable. So I wish this conference a grand success. And not only that, I must admit that I am looking forward to a lot of interventions and initiatives from esteemed members of your community. A lot of feelers are also coming across through the CSR route. And we are excited. And I shall be holding a large part of the responsibility in ensuring that things do happen in the days to come. Thank you all for inviting me.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.